So I work for the National Psoriasis Foundation, so I don't represent a payer, but we've interacted with a lot of payers over the last several years. Part of what we've done in the policy area has been to hold annual roundtables where we talk with payers and really try to understand what their needs are from an information standpoint. One of the things that we've heard for the last several years is that the more information payers can have as they approach their decision-making process, the better it is in order to develop patient-friendly policies and approaches. So one of the things that we have tried to do is support value assessments that really do inform the payer about what the patient needs in order to best manage their disease. You know, preparing to be involved in a value assessment is something that I think can be really intimidating for patient advocacy organizations that have never been involved in that type of work. We really try to encourage those organizations to think about the relationships they have with their patient community and all of the data and information that they've gathered over the existence of their organization. I think oftentimes patient groups think that they don't have anything to contribute to a value assessment, when in fact they really have the pulse on what is challenging their patient community. And so translating that information into information that a value modeler can then use as part of their assessment is incredibly valuable. And many times they're bringing an entirely different perspective than what the value modeler has heard in the past. There really are, and I think one of the things that we've talked a lot to our community about is what an opportunity it is to participate in a value assessment. It's really rare that patients have the opportunity to sit down and talk directly to payers and those folks that influence payers. And so we've been really proud of the way we've been able to invite the patient community to participate in value assessments. We've had individual calls with value modelers and individual patients where they've kind of talked through their disease journey. And then we've also gathered quite a bit of data that can kind of represent the community and be information that payers can look at, as well as the value modelers as they're doing their assessments. In our interactions with them, what we've heard is that it's one of many factors that they consider. And so having a value assessment is helpful. It's something that they look at and read. I think when you're looking at a space like ours that actually has a lot of therapeutic options for the patient community and the physicians that treat our patients to choose from, it is helpful to have these sorts of objective reviews that payers can consider. I think one of the challenges, though, speaking from a chronic disease standpoint, is that all patients don't respond the same way to all treatments. And so we do hear from payers and PBMs that the more tools they can have that speak to, really the precision medicine idea, the fact that not all patients are going to respond the same way to all therapies, and that can help payers as they make decisions about what's going to be most appropriate for that particular patient, are incredibly helpful.